You're unmuted if you want to unmute yourself.
Unmute myself now. There we are. All right. I don't see you on the participants page. Let me see. Well, you're here, but I just don't see. I got to change this. There we go. There we go. Oh, look at that. You're green too. Your mom's green. That's fantastic. Okay, so what do you see on your screen right now?
I see your presentation.
Okay, good. I wanted to start with that and then go and pause the presentation and get back to the discussion of when everybody comes in, and then go for it. I've already put us on to YouTube Live, so we're on YouTube Live. You got your shit.
My detox tea. Morning detox tea.
All right. Okay. So for your camera, okay, you need to get it up on a box a little bit higher, because I'm look at your face, but I'm looking at at your ceiling. Your background is your ceiling rather than your wall. So you should have it more level with your head. So sometimes you know, especially with smaller computers, you have to raise the computer up, like I did with a big box. So you're not looking down at it, you're looking straight at the camera rather than at the keyboard.
Right. Is this better?
Yes, that is better. But the angle is still up. Okay. We're still you're here, and the angle of your camera is still up. So what you want to do is you try to raise your camera up, and then your face is level with the actual camera on your computer.
On the computer. Okay.
And that's one of the reasons. That's one of the reasons why they use those circle lights, and put the camera inside the circle light. Not only does the light help with the face ray, to bring out the colors and so forth, but it also puts the camera up. So when people use their cell phone as the camera, that works better. Okay, so that's great. And there's Jishan. Hi, Jishan.
Hey, Jishan.
Hey.
你怎么穿的这么多呀？
啊，
穿的这么多呀？
热的吗？
All right. Christmas colors now on Jishan. We've got green and we've got red.
就现在是圣诞节的颜色，你穿的是红色，我们穿的是绿色。
我没有绿色衣服。
没有绿色的。我说你就圣诞节的颜色嘛，你是红色，我们是绿色。
对呀，我穿红色要红运当头。
嗯哼。
我要改变一下自己穿衣服，每次衣服修全部就是黑色的。我刚刚买的这个红色的衣服，加绒的。
哦，就这个你刚刚新买的。
今天穿第一次，我说得改变一下，穿一下红色的衣服。
不错不错。很喜欢你的健身的那个视频。
Yeah, wow. Absolutely big. The exercise. I couldn't believe how good you look, Jishan. I mean, absolutely fantastic. That looked like an advertisement if I ever did see one for green. Hunting greens. For matchmaker.
Oh, green.
Okay. So,
检查一个月，没检查。
就运动1个月啊？
检查1个月。
我也得坚持。
现在那哪没穿？
现在来这儿，这半年没来的话，你看他长了10磅肉，我就每天得陪他们去健身。
我想觉得和那个国际饮料全可以，我现在知道108斤，有时候107斤。
对呀，你现在保养比我还好。
我反正保持这个真心不是再减个100斤是可以的了。
你看，我把我们俩那个视频放在一块儿了，你看没有？
我看了，我不点赞的吧，我也分享的啦。
看他谁肉多呀？
你的肉多，我没肉。
好，俺们发的照片。
You're a fat one.
你的肉全刮的，看不见。
Yeah.
你下次要买那种露那个半只腰的那种，露动脉圈那种。
我没穿那个半身腰的，我有啊，我有2件，他们也送2件那个健身的，我那穿的我没照，我只穿的那个短袖。
你把那个肚子露出来，看看有肚皮没有？每天看到镜子要有肚皮才行啊，肚皮收缩才行，
要保守一点。
I don't know if the print down here is actually in translating what you all are saying, but it is kind of funny to watch what the words are
那
coming
你
out.
那你都没发广告的呀？群里面我看都没发呀。
他不发的吧？
Oh, the translation is incorrect.
I'm sure the translation is incorrect. I don't know how we could actually translate anything. But let's go. We're 6 minutes past our hour, and we'll go ahead and get started.
就是他们都没上来呢。
我全发了，但他们都没上来。
那个群里面的，你发群里面了没有？我看那高楼号是没发呀。
发了呀。
前几个星期他们还忘拿。
大概3个星期都忘了。
对啊，是啊，他们就忘了呗。所以，然后这3个星期才有见面，你们的慢慢缓过来了，调整过来了。
Okay, so I want to welcome everybody back to the HealthEagle show, and we want to welcome you and hope that you all had a great Thanksgiving weekend and enjoyed family over the holidays. We've had a little bit of a break, and now we're getting back into it. So happy Thanksgiving, and then welcome back. And now we're into the Christmas season. We will take a break over Christmas season and for Christmas and New Year's, and so we'll get kicked back in. So there'll be another one next week and the next week, and then a break, and then back into January. So we'll go forward from there. I just wanted to relate. You all were out doing exercises, okay, on videos this week, and I really appreciated it because it was really beautiful to watch all my girls out there exercising and getting active and toning muscles. And Jishang, you were just absolutely stunning in that outfit and all your exercises. So very, very excellent. But what happened to me was I was exercising and I hyperextended my elbow. And that means is that I bent the elbow backwards too much. Okay, so it went, it instead of being like this, it went down a little bit. Okay, and that hyperextended this elbow, and that gave me quite a painful start, and I needed to do something right away. And what do we do when we get into a soft tissue injury, everybody? What do we do when we go to a soft tissue injury? We turn to our, everybody, you know this one. This is not hard.
Turn to Procosa.
You gotta go to your Procosa, okay? Procosa, okay? You have to go to Procosa, all right? So here's the thing is that as soon as I knew that I had a soft tissue injury, I went to my Procosa and I took 12 during the first day, 16 the second day, 16 the third day, and guess what? Boom, 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 boom. No more tinnitus, no more pain in my elbow, no more hyperextension. The repair is complete. Okay? It doesn't take much. You over exercise, right? You're going to get some kind of pains in your soft tissues, your muscles, your tendons, your elbows, your knees. Okay, you're going to go to your Percosa. Now, it's up to you to decide what your dosing requirements are in order to get past the pain and get back into full health. But the dosing is officially 3 tablets per day. Okay, for maintenance purposes, I take 1, and then I add based upon the repairs that I need to do. So that's a Percosa. One more time, hurrah, hurrah, hurrah for Percosa, and we'll go on from there. The other day too is that I went down to get some blood drawn, get some blood tests, right? Check to make sure that I'm completely healthy. And this last night, I noticed that at the point where they drew the blood, I had a bit of infection. Okay, I had a bit of blood infection in that artery where they pulled the vein, excuse me, where they pulled the blood. And I said, oh my gosh, now I'm going to have to go to the doctor tomorrow and spend all day at the hospital getting treated for blood poisoning. And I said, nope. So I washed the whole area off with the hand sanitizer, USANA hand sanitizer. I dried it off carefully with the USANA makeup remover. And then I applied my whitening toothpaste. Now, see, whitening toothpaste in a little doblet, you know, like this, right? Can you see that? Okay, a little doblet. And I just went right where the infection was. And then I let it dry. And I let it dry overnight. And guess what? Blood poisoning's gone. Why? We do the same thing with zits on our face, right? You know, we take the whitening toothpaste and put it on the zit, and the zit goes away because it draws the poison out of your skin and heals the skin. It's a very interesting thing when you get to know your USANA products really well and how they can benefit more than one thing or more than just what they were designed to do, okay? Because they're so healthy for you. And then finally, who loves my hair? Who loves my hair, okay? And I know that you gals, you love your hair because you're doing exactly the same thing as me, is that you wash with the Sensei Revitalizing Shampoo. What a great shampoo. You only need a tiny bit. Now remember, you just need a little tiny bit in order to get the right amount of foam. And then you wash, and then you wash a second time so you get it all nice and clean for the Revitalizing Shampoo. And then, of course, followed up with the conditioner. You've got the nourishing conditioner in the hair, and you go from that. Okay, so a little bit about me. All right, this is beautiful brown hair, by the way. Is that my father was completely white haired when he was 36 years old. He started turning when he was about 30 years old, and he turned all white by the time he was 36. And there's a missing nutrients in his body. No feeding it. So you want to feed your hair with the proper nutrition, and that goes with the what? Everybody? What's the proper nutrition? What does everybody start with?
Health pack.
Yeah, health pack. Absolutely. Thank you, Mila. You got to start with the health pack, and that gives you everything that you possibly need, and then go for it. Your hair is an indication of your health, just like your fingernails are. Okay. And if you get yourself into negative medications like drugs, and the time passes, your hair contains the drugs. Okay, your hair is something that it will cut off and analyze and find out if you are doing drugs. So you want to take care of your hair. You want it to last a long time. The Revitalizing Shampoo and the Nourishing Conditioner. One of the things that's really helpful about the Nourishing Conditioner is that no matter how much you use, you have too much. Okay, you put a little dollop in, you get it wet, you put it in your hair, and then it's all in your hair. Then you wash the rest of your body with the body wash. But then guess what? You can nourish your entire body by taking what's in your hair and spreading it throughout your body. Okay, and moisturize your entire skin while you're in the shampoo, in the shower, and you're going to stay healthier. Your skin's going to stay healthier, and it will also look younger longer. All right. First, the next thing is I wanted to tell you that got a new background. Anybody notice? 3 weeks ago, this didn't look like this, right? How's that happen? Okay, so I changed the abodes. New house, new place, and like to welcome you to my my new house with my wife joining me here, my beautiful wife here. Okay. So we now have a new house, and then and Mila, she's got a new background in her house, right? She's got a new house, right? And we're all here in Chiang Mai, in Thailand. All right. So so we're in Thailand and China today, and we will have people joining us from the States, hopefully, before we end our presentation. All right. So what have we been doing? And then I wanted to do is to do a rundown. Is that we're creating relationships to enhance intimacy, to enhance love, to enhance our lives. All right. So we started some weeks ago looking at relationships. We went through nutrition and how that helps with building great relationships. We talked about women's health. We talked about men's health. And now we're into the endocrine system. So we did an orientation, and now we're going through each of the glands and their hormones. And the last time we met, we talked about the hypothalamus and the pituitary gland. Today, we have the thyroid and the parathyroid. Next presentation will be the pineal and the thymus glands, then the adrenal glands and the pancreas, and then finally following up with the ovaries and the testes. Then we'll talk about balancing hormones, and then talk about what disrupts your endocrine system and your hormone system, and then finally get into intimacy and what it is you're afraid to ask. Nobody, you know, the stuff that nobody ever taught you that you really should know. All right. So that's the plan, that's the attack, and that's the schedule that we're on. And why are we doing this? Because we all want to be happy, healthy, and live a full life. And so we're going to go through an anatomy, glands, hormones, and what they do. And just as a refresher, what is the endocrine system? The endocrine system is made up of glands. These glands generate hormones, and they secrete them into your bloodstream. They do this in a slower way of controlling the activities of your body. Now, we want to talk about the how they affect your brain, your heart, your lungs, your liver, your skin, your thymus, all of these tissues and activities. And we're going to go through them one by one, because the endocrine system is really quite complicated because it's so overlapping. And as was mentioned early on, is you have about 150 different kinds of hormones operating in your body, and about 50 of them, okay, 1/3 of them are working right now in your body. So there's more than just testosterone and estrogen, a whole lot more, and we're going to get right to it in that. And we're going to talk about the thymus and the thyroid and the parathyroid today. As an example, we've got hormones are a chemical transmitter, so they're not electrical. Your electrical system is your nervous system, okay? And then you've got a lymph node system that handles your inflammation and oh, help me out with the words, Mila. Your inflammation, your immune system. Okay, so all of these things tied together, but right now we're dealing with the endocrine system, which is all about the hormones and the hormonal controls over your bodies and what they do. Okay, and these are really very, very important. And I can't overestimate the fact that we're going to be talking about the thyroid, which is creates a lot of problems for a lot of people, and the parathyroid, which is the counter to the thyroid. And as before, we're going to do this in with some videos. These are very short videos, but they get right to the meat of the issue. If we get into an early commercial, we'll just have to wait it through until we can get to the actual presentation, because we are utilizing videos off of YouTube. So if we're ready, let's go on to the first one. Linkage is missing. What happened? There we go. Oh, I need to share, don't I? Hang on, go over here, share sound.
Thyroid gland. Yes, that well-known butterfly-shaped gland found in the neck region. Although comparatively tiny, it controls many vital processes in our body, like metabolism, cardiovascular function, and even growth and development. But did you know that an estimated 12% of the population have some form of thyroid disease? Or that women are 5 to 8 times more likely to develop a thyroid disorder than men? Or that thyroid disease, if left untreated, can...
Okay. Mila, oh, we're saying hi to Len. Hi, Len.
Hi.
Welcome. It's good. We want to acknowledge your loss and also welcome you back to our presentation today. And today's on the thyroid and the parathyroid. Mila, were we already with the sound okay?
The sound's okay, but we cannot see the camera. You want to stop sharing and sharing again?
Okay, so we need to stop sharing and sharing again. Which means somewhere along the line, I'm going to have to kill a bunch of products. Okay, can you see it now?
Yes.
Okay. All right, so we're all ready to start again. I will go ahead and bring this back to the beginning, which is only 30 seconds ago.
This is the thyroid gland. Yes, that well-known butterfly-shaped gland found in the neck region. Although comparatively tiny, it controls many vital processes in our body, like metabolism, cardiovascular function, and even growth and development. But did you know that an estimated 12% of the population have some form of thyroid disease? Or that women are 5 to 8 times more likely to develop a thyroid disorder than men? Or that thyroid disease, if left untreated, can put patients at risk of developing cardiovascular disease, infertility, osteoporosis, and more? Sounds like some important things to be aware of, huh? So if you want to learn more about this little yet mighty control centre of the body, stay with us while we explore the thyroid and the parathyroid glands. Before we jump into the details, here's a quick overview of what we'll cover today. We'll begin by looking at the gross anatomy of the thyroid gland, including its lobes. Then we'll identify the parathyroid glands and where they are. Next, we'll look at the cartilaginous and ligamentous structures of the larynx and trachea, upon which the thyroid and parathyroid glands are found. We'll then move into the vascular supply and innervation of the glands. And finally, we'll explore some clinical notes to wrap up. Are you ready? Let's get to it. First of all, what is the thyroid gland? The thyroid gland is an organ that is part of the endocrine system. Its main function is to regulate metabolism throughout the body by producing the hormones triiodothyronine and thyroxine. It also helps to regulate calcium levels in the blood by producing the hormone calcitonin. The thyroid gland is located in the base of the neck, just anterior and lateral to the trachea and inferior portion of the larynx. It spans from approximately the level of C5 to T1. The thyroid gland is generally butterfly or H-shaped in appearance and is composed of two primary lobes, each with a defined superior and inferior pole. These two main lobes are simply known as the right lobe and the left lobe of the thyroid gland, and are roughly similar in size and shape. Connecting the two lobes is a region of the thyroid gland called the isthmus, which we can see from both an anterior and posterior view. In many people, there can be a smaller third lobe, which is only present in about 40% of the population. This is the pyramidal lobe of the thyroid gland and can vary in size and appearance. It is thought to be a remnant of the thyroglossal duct, which is present during development. Functionally, however, it is the same as the other lobes of the thyroid gland. The other glands that feature in this tutorial are the parathyroid glands, which we can now see highlighted in green. In this image, we're looking at the thyroid gland from a posterior view, the left lobe being here, on the left of the screen, and the right lobe being here. Usually there are 4 parathyroid glands in total, 2 on the posterior aspect of each lobe of the thyroid gland. Each parathyroid gland is about the size and shape of a pea at roughly 6 millimeters long, 3 to 4 millimeters wide, 1 to 2 millimeters deep, and weighing on average 50 to 60 milligrams.
This video is not over yet. Continue watching now the full.
Right. So this video is over. So we're going to stop the share, right? And we're going to go back to the presentation. And so we're going to go to another video on the thyroid gland. All right. And let me know if you got this one, Mila. Okay, do you have it, Mila? Oh, I can't hear you, Mila.
你没打开。
Okay.
Oh, I cannot see the videos.
Okay, so I need to do the same thing I did before. Why every time I have to do this?
And also the volume too.
I got to share it again.
Yeah.
No, it says I'm sharing sound.
Okay, then just share the video.
Okay. There's nothing else going on in the background. Nothing else going on in there. All right. So the second video.
Would you able load up the video? I see the last video screen still.
Okay, can you see this one?
No, I only see the last video.
Endocrine gland located in the neck. It is wrapped around the trachea.
All right. So you cannot see this one, Mila?
No. We are still on the screen, which is the
Last screen.
video. So stop sharing. Yeah.
Okay, stop sharing. Okay, start sharing. Okay, so you're seeing me in G Sheet right now.
Yes.
All right, so we're sharing that. And what we want to do is to close
There we go.
this. Close that. Close that. Okay. And I'm going to go back up here. Open that. I love it. Let me know if you got it, Mila.
Okay. I'm seeing the screen right now.
Okay, so you see the movie start?
Yes.
All right.
Kalau mah.
The thyroid is a butterfly
Yes. Go ahead. You can play now.
All right, it's playing.
The thyroid is a butterfly-shaped endocrine gland located in the neck. It is wrapped around the trachea, just below the thyroid cartilage, the Adam's apple. The two major hormones of the thyroid are triiodothyronine, T3, and thyroxine, T4. The numbers 3 and 4 indicate the number of iodine atoms present in a molecule of each hormone. T3 and T4 are collectively referred to as thyroid hormones. Thyroid hormone secretion is under control of thyroid-stimulating hormone, TSH, from the anterior pituitary. TSH, in turn, is induced by thyrotropin-releasing hormone, TRH, produced by the hypothalamus. The amount of circulating thyroid hormones is regulated by a negative feedback loop. When their levels are too high, they suppress the production of TSH and TRH, consequently inhibiting their own production. Thyroid hormones act to increase the body's metabolic rate. They stimulate appetite, digestion, breakdown of nutrients, and absorption. They also increase oxygen consumption, raise the breathing rate, heart rate, and contraction strength. As a result, the body's heat production is increased. Thyroid hormone secretion usually rises in winter months to keep the body warm. There are two major groups of thyroid problems. Hypothyroidism, when the thyroid does not produce enough hormones, resulting in a low metabolic rate, combined with slow respiratory and cardiovascular activities. Common symptoms include fatigue, weight gain despite poor appetite, cold intolerance, slow heart rate, heavy menstrual bleeding, and constipation. Iodine deficiency and Hashimoto's thyroiditis are the most common causes. Hashimoto's thyroiditis is an autoimmune disease in which the thyroid gland is gradually destroyed by the body's own immune system. Hypothyroidism, especially when caused by iodine deficiency, may lead to swelling of the thyroid gland, known as goiter. In an attempt to fix the low levels of thyroid hormones, the pituitary produces more TSH to further stimulate the thyroid gland. The thyroid, while unable to make hormones without iodine, responds to TSH by growing in size. Hypothyroidism is managed with thyroxine hormone replacement. Hyperthyroidism, when the thyroid gland produces too much hormones, resulting in a too active metabolism, together with respiratory and cardiovascular rates that are higher than necessary. Common symptoms include irritability, insomnia, weight loss despite good appetite, heat intolerance, heart racing, and diarrhea. Hyperthyroidism is most commonly caused by Graves' disease, another autoimmune disorder characterized by presence of an antibody called thyroid-stimulating immunoglobulin, TSI. TSI, similar to TSH, stimulates the thyroid gland to produce hormones. Unlike TSH, however, TSI is not regulated by negative feedback mechanisms, leading to uncontrolled production of thyroid hormones. TSI also stimulates the thyroid gland to grow, which may lead to formation of a goiter. Hyperthyroidism may be managed with drugs that suppress thyroid function, radioactive iodine that selectively destroys the thyroid gland, or surgery that removes part of the gland. Thank you for watching. Please feel free to suggest a topic you want to.
Hey, stop sharing. That's an important component, right?
Yes.
And now we want to go back to sharing,
Mhm.
and which is not going to take me back to my presentation, which is really very disturbing. So let me get you guys moved out of the way, change the view, exit full screen, go back to my presentation.
Hypothalamus.
Yeah, I think get rid of that. Okay. And we're back here, which is great because that's where I wanted to be. All right. So A little bit more development on the thyroid. Nope, that's not what we wanted to be, because we want to be here.
We have not shared the screen yet.
Oh, dear me.
还没有常规的方法画画，不懂创作，缺乏想象力。那么学了画家基底课的孩子早已掌握丰富的绘画技巧，那画出创意画。
Okay, skip ad. Stop.
That sounds Chinese.
Okay. Now I need to do that. I see you, Mila. You know, so soon we forget what it was we were doing. Oh, that's not what we want to do. What I want to do is to go back and find my share button.
Should be button of your page.
Yeah, but it's hidden. That was the problem. So now I'm back. So we can share this. All right. Now we want to go back down to our presentation here. All right, so is everybody seeing the list of videos now?
Yes.
Okay. And let me make sure that we're sharing sound. We're sharing sound. All right, so we're sharing this. Now, that should indicate. Yeah, I can see Lynn, John, and so forth. So let me go to our presentation and share screen, right? So I'm sharing screen, so that's a good thing. You seen the video now?
Yes.
Okay. All right, go to full screen.
Among all hormonal problems, thyroid diseases are the most common ones.
Okay, that's internet issue.
Thyroid diseases can be divided into three major groups. There is an excessive production of the thyroid hormone, which is called hyperthyroidism. There is decreased production of the thyroid hormone, which is called hypothyroidism. Multiple nodules or generalized swelling of the thyroid gland is called a goiter. Hyperthyroidism means that the thyroid gland is producing excessive thyroid hormone. It causes increased metabolism, which consumes a lot of your energy. It is the main reason why people having hyperthyroidism feel tired. Many people with hyperthyroidism are also nervous and stressed, which makes them even more tired. Hyperthyroidism can be treated. Hyperthyroidism has many symptoms because all of the processes in the body work much faster. Common complaints are feeling warm, shortness of breath during exercise, loss of strength, menstrual problems, weight loss, increased heart rate, diarrhea, and psychological complaints like fear and irritability. These symptoms usually do not all occur at the same time. In some cases, the thyroid gland might also be enlarged. The most common cause of hyperthyroidism is Graves' disease. It is an autoimmune disease where your body produces antibodies to stimulate the thyroid gland, which produces excessive thyroid hormone, more than the requirement for normal functioning of the body. Graves' disease may also cause eye problems. Unlike hyperthyroidism, hypothyroidism means that the thyroid gland produces decreased thyroid hormone, which leads to reduced metabolism. Symptoms of hypothyroidism are feeling tired, feeling cold, heart problems, increased in weight, depressed feelings, hair loss, hoarse and deeper voice, and bowel problems. One of the common causes of hypothyroidism is Hashimoto's disease. In Hashimoto's disease, there is an immune response of the body against the thyroid gland, which causes decreased function of the thyroid. Hypothyroidism can result from treatment of hyperactive thyroid. Thyroid disorders can also be caused by changes in the structure or form of the thyroid. In some cases, the thyroid might be enlarged. Goiter is one of the most common thyroid problems. When you have goiter, the thyroid gland gets enlarged and there is visible swelling in the neck. Goiter has several causes, such as infection, iodine deficiency, benign or malignant disease. A malignant disorder is extremely rare. When you have goiter, there can be a problem in swallowing or breathing. Before treating goiter, the underlying cause must be determined. Thyroid problems can be diagnosed with blood test and sometimes using a thyroid scan or a puncture. Other times, thyroid swelling disappears even without treatment. Hypothyroidism can be treated with thyroid hormone pills. Depending on the cause, hyperthyroidism can be treated with medication to reduce the production of thyroid hormone. Another option is treatment with radioactive iodine to stop the function of thyroid cells. Surgery can also treat hyperthyroidism. Goiter can be treated with surgery or with radioactive iodine. Do you have any symptoms which might indicate thyroid problems? Please consult your general practitioner for advice.
All right, we're going to stop sharing. Hurrah! And we're going to get out of this.
Hypothyroidism and hyperthyroidism.
Hypo, right, is what? What is hypo?
Too little.
Too little.
Thyroid.
And what's the other one?
Hyper.
Hyper, and that means what?
Too much thyroid hormone.
That's right. Okay, so hypo, too little, thyroid hormone, and then hyper is too much. And which one is associated, which disease is normally associated with the hypo?
It's the Hashimoto's disease.
Hashimoto's disease. That's right. And then the other disease for hyper.
It's Graves' disease.
Graves' disease. Yeah, yeah. Okay. So, and goiter is where the thyroid gets big, right? Right. So if you can think about hypo and hyper, right? And you think about it in terms of the metabolism. Hyper, right, is about increased metabolism. Hypo is associated with decreased metabolism. So you can now separate out, by remembering those two things, you can separate out the various different symptoms, right? So if you've got hyper and you're more active, right, and your metabolism is higher, what's your weight going to do?
You'll be losing
weight, okay? And hypo, where your metabolism is slower, means that you're not going to be, your body's not going to be using the food that you eat, so therefore your weight's going to go up. Okay, and then if you're hyper, right, you're going to be more nervous and anxious and tired, and your hypo, you're going to be more tired, and you're going to be you're not going to have the energy of your normal energy level. Okay, so when you're talking with your clients, right, you're going to be able to hear what they have to say. Okay, now do you remember what the hormones? You got the basis of the hormones there. We've talked about T3 and T4. Now T3, you get a whole lot of that. T4, you get a little bit, but basically T4 turns into T3, and you can think about T3 and T4 as the same hormone associated with metabolism. The other hormone that the thyroid generates is calcitonin. And calcitonin is associated with the calcium in the blood. And we're going to get to that in just a minute. So let me go back to sharing. Okay. Now everybody can see that we're sharing. Okay, we are sharing. All right, so we're going to go back here. Are you looking at the presentation again?
Yes.
I want to go to this calcium importance one, and then come back to the parathyroid. Okay. Oh. There we go. Now, you should see this now, Mila. Is that?
Yes.
Yes.
Hi, Dr. Jim Norman here. I'm going to discuss today what is calcium.
Come on, Jim. Come back to us. There we go. All right.
Calcium and why calcium is so important in our bodies. Calcium is the most important element in our bodies. And
Don't go away too long.
as you will learn, because calcium is so important, we all have a control system that regulates how much calcium is in our blood and how much calcium is in our bones. This control system is the parathyroid glands. First, let's talk about what calcium does in our body. Our bodies use calcium as the electrical system that runs the nerves and muscles.
Wow.
Everybody knows that calcium makes our bones hard, but that is not the most important thing that calcium does for us. The most important thing that calcium does for us is it runs the electrical system of our bodies. All mammals, dogs, cats, horses, elephants, humans, we have an advanced nervous system that allows us to move and to think. Our nervous system, all the nerves in our bodies, including our brain, was designed to use calcium as the chemical electricity. If you think about the electrical system in your house, there are electrons that flow through the wires and the walls, which powers our appliances. We don't use electricity quite this way in our bodies. We'd all be sparking and catching on fire if we did. Instead, we use calcium to flow along the nerves as a way to conduct chemical electricity. We then use calcium flowing into and out of muscle cells to make the muscles expand and contract. Calcium is the most important element in our bodies because it provides the chemical energy that we use to do most things. Calcium runs the electrical system of our bodies. We all know that the electricity in our homes is kept at a very constant level at all times by the power company. We don't have 110 volts coming out of the walls on Monday and 150 volts coming out on Tuesday. If we did, our light bulbs would burn out earlier, our appliances would wear out much faster. Just as the power company controls how much electricity is flowing through the wires in your house, our bodies have a control system that regulates how much calcium is in our blood and how much calcium is in our nervous system. As I said before, the control system for calcium in our bodies is the parathyroid glands. The job of the parathyroid glands is to control the calcium in our bodies in a very small normal range. These four little glands are supposed to make sure the calcium never goes too low or too high. The parathyroid glands in our bodies regulates the chemical energy just like the power company regulates the electrical energy in our homes. Of all the elements in our bodies, sodium, potassium, chloride, phosphorus, magnesium, zinc, and all the others, only one element in our bodies has a control system. That's calcium. No other element has a control system, and no other element is regulated in such a small normal range. In fact, the control of calcium is so important to our health that it is quadruple redundant. That is, we all have 4 parathyroid glands, all doing the same thing. Just as NASA has backup systems for most important parts of their space shuttle, our bodies were designed with a backup system for the control of calcium. We all have 4 parathyroid glands. Quadruple redundancy does not exist anywhere else in our bodies. We have 1 liver, 1 thyroid, 1 stomach. We have 2 kidneys, 2 ovaries, 2 eyes, 2 ears. but we have 4 parathyroid glands all doing the same thing, and almost always they do a fantastic job of regulating our calcium. Because these glands do such a good job, almost everybody watching this video has never heard of a parathyroid gland, because the parathyroid glands work fantastic for our entire lives and almost all people. The glands don't go bad very often. But when the glands do go bad, we can suffer the consequences in many different parts of our bodies. When parathyroid glands go bad, it is typically because one of them went crazy and developed a tumor. This out-of-control tumor is like a power plant with a meltdown. There's too much calcium in our blood, and this increase in calcium can have a tremendous effect on our nervous system, how much energy we have, how tired we feel, how well we sleep, how our heart beats, and many other issues. In closing, we use calcium as the chemical energy of our bodies. Sure, calcium makes our bones hard, but it's a well-regulated blood calcium that makes us feel good and enjoy life.
Now I got, all right. Go back over here and close that out. Okay, close all these things out. Too many things in the way. Sorry about that, guys.
Yeah, that's
You get
interesting.
studying, you get, yeah, it is really interesting. It's the first time I have ever heard that discussion about calcium and the electrical system. And I found it really, really fascinating to see how much more important calcium is. And you remember, Mila, when we were first talking about calcium, and women need it, men don't kind of discussion.
Mm-hmm.
And then I found out that men need it as much as women because it controls the muscles, right? Muscle contraction, right?
Yes.
And so, every movement of your stomach, every movement of your heart, and that sort of thing are all tied back to calcium. And then, of course, going into this conversation, finding out about the electrical impulses that create those movements is really important. And now you go and say, okay, we're learning about the glands, and we're talking about the thyroid and the parathyroid. And we were just talking about the thyroid, and the thyroid generates calcitonin. And the parathyroid develops parathyroid hormone. And the calcitonin helps put bone into storage. So it gets the calcium out of the blood and puts it into the bone, so it's stored there in the bone. The parathyroid hormone gets the calcium out of the bone so that it can be put back into the bloodstream so that it can be used by the body. So that's the two operating hormones that control the level of calcium in your body. So and basically the parathyroid controls the amount of calcitonin that's released, because if there's too much calcium in the blood, it will generate calcitonin to put the calcium back into the bone. And but the parathyroid is getting its signals from the hypothalamus. Okay. So what we want to do is go back to our presentation, and quite frankly, what I need to do is I need to go back to share. That didn't help me much because it's not showing my presentation anymore, which is really kind of crazy, but that's not what we want either, because that's where we were, right? Let's get rid of that. Yeah, send feedback. Okay, here's send feedback. All right, so back over here. Now I wanted to go up here to the parathyroid, and that's going to give us more information about the parathyroid. And here we go. Mila, you let me know if we're there. We should be sharing again, right?
Yes.
Whether you're in school or at the hospital, Every medical student knows it's next to impossible to retrieve all necessary information related to important
Parathyroid glands. In this topic, we will be discussing the location, size and shape, blood supply, nerve supply, microscopic structure and functions, clinical correlation, and the development. The parathyroid glands are two pairs, superior and inferior, of small endocrine glands located along the posterior border of the thyroid lobes within the thyroid capsule.
It's basically
They appear as small yellowish-brown bodies. The parathyroid glands secrete parathormone, which maintains blood calcium level by mobilizing the calcium from the bones. Its action is opposite to that of calcitonin secreted by the thyroid. Location. The superior parathyroid lies at the middle of the posterior border of the thyroid lobe above the level at which inferior thyroid artery crosses the recurrent laryngeal nerve. They develop from the fourth pharyngeal pouch and hence is also termed as parathyroid 4. The inferior parathyroid lies on the posterior border of the thyroid lobe near its lower pole, below the inferior thyroid artery. They develop from the third pharyngeal pouch, hence also termed as parathyroid 3. Size and shape. They are small, oval, or lentiform in shape. Each gland measures about 6 millimeters in length, 4 millimeters in breadth, and 2 millimeters in thickness, the size of a split pea, and weighs about 50 milligrams. Blood supply. The parathyroid glands have rich blood supply. The superior parathyroid is supplied by the superior parathyroid artery, a branch from anastomotic artery joining the superior and the inferior thyroid arteries, or from inferior thyroid artery. The inferior parathyroid is supplied by the inferior parathyroid artery, a branch of inferior thyroid artery. Nerve supply. The parathyroid glands are supplied by the sympathetic fibers derived from the superior and middle cervical sympathetic ganglia, or the sympathetic plexus around the inferior thyroid artery. These fibers are vasomotor in nature. The secretory activity of the gland is controlled by blood calcium level. Low level of calcium stimulates secretion, whereas high levels of calcium inhibit the secretion. Microscopic structure and functions. The parenchymal cells of the gland form irregular anastomosing cords or groups of cells. The parenchymal cells are of two types: principal or chief cells and the oxyphil cells. The chief cells form the major population and secrete parathyroid hormone called parathormone. The oxyphil cells form minor population and their function is not known. The parathyroid hormone plays an important role in calcium metabolism. It maintains the blood calcium level by enhancing the mobilization of calcium from bones by osteoclastic activity, increasing the reabsorption of calcium by proximal renal tubules, promoting the absorption of dietary calcium from small intestine. Clinical correlation. Hypoparathyroidism may occur spontaneously or due to inadvertent removal of parathyroid glands during thyroidectomy. It results in tetany due to low blood calcium level. Clinically, the tetany presents as increased neuromuscular excitability, causing convulsions and carpopedal spasms. Hyperparathyroidism is seen in the tumors of the parathyroid glands. The increased amount of parathormone removes excess calcium from bones, which makes the bones soft due to decalcification, leading to a clinical condition called generalized osteoitis fibrosa and may cause formation of stones in the kidney. Development. The inferior parathyroid gland develops from the third pharyngeal pouch along with the thymus. As the thymic diverticulum migrates inferiorly in the neck, it pulls inferior parathyroid with it. Consequently, the inferior parathyroid comes to lie finally on the posterior surface of the thyroid lobe near the lower pole. The superior parathyroid gland develops from the fourth pharyngeal pouch and finally lies on the posterior surface of the thyroid lobe at the level of isthmus.
你的孩子是这样画房子的吗？先画一个梯形的屋顶，
正方形，那叫房子，然后画正方形的窗户。
I thought I'd come on here today because I wanted to talk to you about some ugly stereotypes that go around. I've been hearing a lot of unfair, unseemly, and unscientific generalizations being made lately. They mostly have to do with sex.
你家孩子如果这样画，不太简单枯燥。
Okay, we saw that guy early, or when we were just doing our orientation of hormones. I wish he did more presentations because I always found them to be entertaining. However, we're back to where we were, so now we need to get back to where we want to be. I just love it. Okay, I need to screen share again. There we go. All right, so we're back to parathyroid, and then we want to go to the hyperparathyroidism presentation. Good, Mila? Okay.
Hyperparathyroidism is a disease of the parathyroid glands, affecting 1 in 800 people during their lifetime, and 1 in 250 women over age 50. Since parathyroid glands control the levels of calcium in our bodies, hyperparathyroidism is a disease of improper calcium regulation. There are 4 parathyroid glands located behind the thyroid gland. Parathyroid glands monitor and control the amount of calcium in our blood and bones by secreting a hormone called Parathyroid Hormone, or PTH. Each gland monitors the blood calcium and responds by making more or less PTH hormone. Hyperparathyroidism is a disease that occurs when one of the parathyroid glands develops a tumor. This tumor produces far too much parathyroid hormone, which is released into the bloodstream. The excess parathyroid hormone travels through the blood and into the bones. The hormone activates cells within the bones to eat away at the bones, often causing osteoporosis, fractures, and bone pain. The destruction of bone releases calcium into the blood. High blood calcium levels are seen in almost all patients with a parathyroid tumor. The excess calcium can build up in the arteries, increasing atherosclerosis throughout the body. This can lead to high blood pressure and increase risks for heart attack and stroke. The high calcium often affects the electrical system of the heart, causing atrial fibrillation and palpitations. The excess blood calcium builds up in the kidneys, forming kidney stones, and occasionally causing kidney failure. High calcium levels also affect the brain. Since we use calcium in the electrical system of our nerves, a high blood calcium is associated with a slower nervous system, which gives symptoms of tiredness, memory loss, and poor concentration. Many patients with high blood calcium have chronic fatigue for this reason. High calcium levels have an effect on the stomach and intestines, often causing gastroesophageal reflux disease, also known as GERD, and abdominal discomfort. High blood calcium is even associated with higher risks of several cancers, including breast, prostate, colon, and kidney, some of which are more than twice as common in patients with high blood calcium. It is estimated that untreated hyperparathyroidism can decrease a patient's life expectancy by 5 or 6 years, even when the calcium is only slightly elevated. There are no drugs, pills, or other treatments that can slow the process of bone destruction or take the place of surgical removal of the parathyroid tumor. Hyperparathyroidism is cured by surgical removal of the parathyroid tumor. In the hands of an expert, parathyroid surgery is a straightforward outpatient procedure that can often be completed in less than 20 minutes. Since as many as 30% of patients with hyperparathyroidism will have more than one parathyroid tumor, your surgeon will examine all 4 parathyroid glands to be sure a second tumor has not been left behind. Once all parathyroid tumors have been removed, the disease is cured. The process of eating away at the bones stops within minutes. Bone pain is typically gone within a few hours. The bones begin to regenerate within days, and the osteoporosis begins to improve. The excess calcium in the blood will be gone within a few hours, and within a week or two, most patients feel significantly better. The health risks of high blood calcium begin diminishing within days of parathyroid tumor removal. Hyperparathyroidism is a disease that typically makes people feel bad while it slowly destroys their body. All patients with hyperparathyroidism should be evaluated for a straightforward operation to remove the parathyroid tumor. Curing this disease has a tremendous impact on a patient's overall health and their quality of life.
Download the Parathyroid Diagnosis app at
That's good. All right, so we're not going to stop sharing. We're now where we need to be. How cool is that? All right. Now, yes, and welcome, Lily. Hello, Lily. Unmute for a minute. Lily, you're muted. Let's go back over here, and there we go. Ask to unmute. There we go. There you go. Hi, Lily. How are you?
Okay. So I mean, okay. So now is here. It's good now, huh?
Yeah, I can hear you now. Yeah.
Okay, got it.
So
hi.
Yeah, this whole presentation is on YouTube, Lily. So you'll be able to catch back up pretty quick when you go on YouTube. And
okay.
But I hope you had a wonderful Thanksgiving, and we're so happy to have you with us tonight.
Okay, thank you.
All right, so we're going to do a little sum up of what we just saw, and we're going to talk a little bit about the thyroid gland. Okay, the thyroid gland secretes 3 hormones: the T3 and the T4. Okay. And those, just think about them in terms of being your metabolism, control your metabolism. And then the third hormone is calcitonin, which controls your calcium, along with the parathyroid hormone. And okay, so T3, T4 regulates from your pituitary gland. It's given its signals that way, which is generated out of the hypothalamus. And you learned about the hypothalamus last presentation, okay? The hypothalamus controls the pituitary. The pituitary is the controlling gland, which then sends out the signals to the other glands to tell them what to do, okay? Where the nervous system and the endocrine system come together is in the hypothalamus, right? And the hypothalamus has two ways to talk to the pituitary, and that's there's a glandular connection, and then there's the nervous system that ties in. Okay, so going back in, then the calcitonin works to control the calcium and potassium levels. And what it does is it moves the calcium in the blood to the bone, right? And then, as we learned in previous videos, the parathyroid hormone moves the calcium from the bone to the blood, so that you get this balance between your in your calcium. Okay. There we go. It gives you a little picture of the thyroid right here in the neck, right? And it runs around the larynx, which is your where you your throat and your voice box located, and you'll find it just under the Adam's apple, right in here. Okay, and so it's a butterfly. It's connected by what is called an isthmus, which is a small piece. It's like if you have an island and a mainland, and sometimes there's a piece of land that goes between them. That's called an isthmus as well. So it's together. So, and this shows you the connection between the hypothalamus, the pituitary gland, and the different hormones that go and connect up, and then the hormones generated by the thyroid gland. Again, the metabolic rate and protein synthesis, okay? It also will regulate in the human growth hormone, but we'll get more into that when we talk about the thymus and the pineal gland, okay? And then you've got the hormone calcitonin. It keeps your calcium in homeostasis. Homeostasis means balance, okay? Homo is people, right? And stasis is life. So in order for there to be life there in a human, there has to be this balance. That's what homeostasis means, all right? So the calcium homeostasis is to keep it in balance, make sure it's not too much, make sure it's not too little, okay? And then the parathyroid hormone, which acts to take the calcium from the bone and brings it into the blood. Okay, thyroid conditions, things you might run into when you're talking with clients and so forth. You've got the goiter, which is when the thyroid gets too big, right? You get the inflammation of the thyroid, viral infection or an autoimmune system. It'll be thyroiditis. Hyperthyroidism is the generation of too much hormone. Hypo is too little hormone. Right? So you're making your metabolism is too low with hypo, and it's too high with hyper. Graves' disease is associated with which one, Mila?
Graves' disease associated with
hyperthyroidism, which then goes and says that Japanese word is Hashimoto's disease, and that's associated with too little thyroid hormone. There's also thyroid cancer, which then is treated with surgeries. Thyroid nodules, they're like tumors, and if you get a situation where there's a massive amount of hyperthyroidism, that is it's high, that's called a storm, and we learned that terminology back when we did the orientation on hormones. When there's no control over the hormones, you generate this storm of hormones, which can cause a lot of people a lot of problems. Now the parathyroid, okay, are these 4 glands, as was explained, each gland does exactly the same thing. So it's quadruple protection to your body, and it's electro connectivity, which was really very, very interesting piece of new news from today, right? We've not really seen it before. And it goes back and says, okay, well, if we want to make sure that we're healthy, we need to make sure that we have the right amount of
calcium.
Calcium. All right. So what product do you go to in USANA for your calcium?
Mega Calci.
They can go to Mega Calci and also the chewable calcium. Those are 2 products provided by USANA that can help increase the amount of calcium that's available to the body. And in order to absorb calcium into your body, what do you need?
You need the glucose.
No, you need vitamin D.
Vitamin D, oh yes.
To properly absorb calcium into the body, you need vitamin D. All right, and through various different mechanisms to bring about. So you need to have that vitamin D in order to properly generate your to get the calcium in the body. So why does USANA make the Mega Cal D?
Because they're 3 combined, right? You need magnesium, calcium, vitamin D to absorb that.
Yeah. So the calcium for contractions and the support for the neuromuscular system, the magnesium for the relaxation and able to relax from the neuromuscular system, and the D for the absorption and the ability to put the calcium into the bloodstream and to move it about the body. Okay. And we learn more and more about the importance of vitamin D. So what products can you get vitamin D from the USANA line?
The vitamin D.
Okay, vitamin D, that's a great one. All right, anybody else? Anything else? Where can you get vitamin D?
Mega Cal D.
Mega Cal D, that's 2. All right, where else can you get vitamin D? How about you, Lily? Can you get vitamin D?
Yeah, I eat vitamin D now.
Yeah. Okay. So how do you get your vitamin D?
I don't know. I just eat the pills.
You eat the pills. All right. So there's a number of ways. Okay. So we talked about the Mega Cal D. Okay. So there's D in that. We talked about the vitamin D supplement, and we know that there's 2,000 IUs in each pill. So if you want to get to 6,000 IUs, you take 3 a day. Okay, if you want to get to 8,000 IUs, you're going to take 4 a day. All right. So you got that. You've also got your Mega Cal D. Then where else are you going to find vitamin D in your USANA supplements?
From USANA?
Yeah, from USANA. Where else? You've already talked about the vitamin D supplement, which you get in the 1 bottle that says vitamin D on it. You get it from the Mega Cal D, which you need to take every day. It's also in your health pack. Right?
Oh.
Right?
Oh,
and
healthy pack have calcium, right?
Yeah, where else are you going to find it?
Calcium, healthy pack, calcium, vitamin D from. Oh, that's all. That's all I think.
Okay, no, it's in your vitamin antioxidants as well. Okay, so you're going to find vitamin D in your health pack, not just in the Mega Cal D, but you're going to find it also in the vitamin antioxidant component of your
antioxidant have vitamin D.
Your vitamin antioxidant, your Mega So you've got the, in your health pack, you've got the minerals and you've got the vitamins and antioxidants. You've got the Mega Cal D, and you also have the Cell Centrals Booster. Those are 6 pills in your health pack.
Oh.
Right? Okay, so you're going to get vitamin D from your sunshine. And you have to have exposed skin, so you can't get sunshine much in the wintertime because there's not much sunshine, plus the fact that you're covering up your skin. So that's why you need to supplement with your vitamin D. And vitamin D is going to affect a lot of things in your body, including your mood, and it's also going to affect your health, and it's going to affect your ability to absorb calcium. So you need to have your vitamin D. And you get your vitamin D through supplement, you're going to get your vitamin D through your Mega Cal D, and you're going to get your vitamin D through your mega antioxidant, okay, part of it. So those are 4 different ways to get vitamin D, and we all know that we need to supplement with vitamin D, especially in the higher latitudes. Okay, here in Thailand, I'm getting a lot of vitamin D because I look up in the sky and I get all that beautiful sunshine on my face, and it's just good, and it's all nice and warm.
Yeah.
Okay. But in Alaska, we all need to take extra vitamins. All right. So now, if you look at your thyroid, all right, if you look at the front of your neck, are you going to see the parathyroid? If you opened up the neck, pull the skin away. If you look at the front, okay, are you going to see the parathyroid? No, because you can only
Parathyroid.
Yeah, you're only going to see that. Somebody needs to mute, please. Dishang, I think you need to mute. Okay, thank you. So the parathyroid is actually accessible. Okay, so it helps you absorb your calcium through your food. It helps you absorb the calcium through the kidneys, conserve them. It helps the transformation of calcium, and you need to have that vitamin D. All right.
Good.
Okay. We're going to talk about the hyperthyroidism. 1 in 100 people and 1 in 50 women over 50. Okay, so 3 of you are in this situation, and we need to make sure that you're monitoring your parathyroid for hyperthyroidism. All right, so you want to look for the various different symptoms of that. And hyperthyroidism is what? It's the generation of too much parathyroid hormone, which means that you're now eating your bone, right? You're now eating your bones. So we know that you get your osteoporosis that way, right? You also are not feeding your nervous system, and you're going to be losing weight. That sort of thing. Okay. All right. So symptoms of hyperthyroidism is your chronic fatigue, feeling tired, general feeling of being ill, lack of interest in activities. Okay, so you're going to be depressed in that way. Difficult concentrating and focusing on items because now you're slowing down the nervous system in your brain. As you said, depression and anxiety. You're going to have osteoporosis and osteopenia, which is the bone loss or the low bone density. Now, I say them both together because bone loss is actually disappearance, and the bone density means making it less strong. Okay. You're going to have feelings of pain in your bones, which will include your hands, feet, and so forth. You're going to need to take naps. You're going to be irritable. You're going to suffer memory loss, and, which is really interesting, you're going to suffer acid reflux disease. They're now calling it the gastroesophageal reflex disease because gastro is at the lower part of the stomach. There's a little flap that keeps the food from going into your intestines. That's there, plus the gas, right? And then the esophagus is a little flap up here, at the bottom of the throat before the food gets into your stomach, and that little flap opens up, and if the gas gets up here, it'll get irritated, and therefore you're going to have pain, which is known as heartburn, right? So heartburn is here. That's usually associated with esophageal gas, where you've got acid burning your esophagus, and then you've got the gas there. Okay, so that's the current terminologies. You're also going to have with hyperparathyroidism, you're going to see a decrease in sex drive. You're going to see a thinning of hair or loss of hair, usually in the very front. You could have kidney stones, chronic kidney disease. You suffer from hypertension or high blood pressure, right? Headaches. You've got heart palpitations. That's where you're. Okay, that's a heart palpitation. Okay, and instead of. Okay, that's normal. That's not normal. Okay. You're going to have issues, and you can test this with liver tests, and then these blood protein tests that go in. Okay. Normal people who are suffering from hyperthyroidism will have 5 to 6 of these categories of or symptoms, right? Varying based upon time and effort. Okay. All right. Summing up everything is that hormones are chemicals. They travel through your blood, so they work slower than your nervous system. Okay. You have 150 hormones, and at any one time you could have as many as 50 hormones working in your body. Okay, they affect everything from your brain to your heart to your lungs to your liver to your sexual desire and sexual function. Okay, it's very, very complicated, and your diet matters. What you feed your body affects your hormones. That should go without saying. I mean, it should be pretty common to know that you are what you eat. And if you don't eat the right thing, you're not going to be the right person. Does that make sense? Anybody disagree with that? Okay. So eating the right thing is different for everybody, right? There's a baseline, and then there's the optimizers, and that's what the USANA is about: personalized nutrition. What you need is your job to figure out, okay? And it's the information that we try to provide in these presentations and throughout all of the presentations that you're exposed to in this USANA Life, is to help you make those kinds of decisions as to what it is your body needs based upon how you are, how you're feeling, and what you're doing. In this light, you need to make sure you're feeding your body. And one of the components of that, what did we learn today of being able to feed your body, your thyroid and your parathyroid? What do we need to feed our bodies? Come on.
Calcium.
Calcium. What gets the calcium into the blood? You got to have vitamin D. You got to have your vitamin D. And you need to be able to have a whole bunch of other vitamins, and like CoQ10. Very, very important for moving things in and around your body and getting them in the right place and making sure they don't clog up. And your K2, right, is going to keep your calcium in solution so it doesn't build up on the insides of the linings of your arteries and your veins, right? So all of these things, and you can get K2 two ways, basically through your health pack and through the unique optimizer supplement. Okay, we can go with that. Again, looking at what your body does is just amazing, and this just happens to be the how the body metabolizes cholesterol into estrogens and testosterone and the and those particular hormones. So, and also in the way it feeds the mitochondria. All right. It's a little bit complex, but the interesting thing about it is that, you know, this is what our body's doing, and we need to make sure that our body's being fed properly. All right, this is the last slide, and this goes back to where we're going with these presentations, and that pretty much is to make this connection between nutrition and relationships, right? And the whole thing is that nutrition creates better health, health creates better mood creates better feelings create better behaviors create better relationships, right? And if you have a better relationship, then you're able to have more intimacy. If you have more intimacy, then you can have more sex. And if you have more sex, you have reproduction, which is the basis of life. Okay, so leading up to that, I've got some additional links there in this presentation, which is available to you. And we hope to see you on the next presentation, which we are going to talk about this one. Okay. We just finished up the thyroid and parathyroid glands, so we're into the pineal and the thymus. And I bet you don't know anything at all about the pineal gland or the thymus or what they do.
No, I mean, sounds like a pineapple, that's all.
That sounds like a pineapple. All right, so we're going to get into that next week, and then into the adrenals and the pancreas, and then into the ovaries and the testes, and then how they all function together and how we protect them, and then how we can get to that end product of having great relationships with fantastic intimacy. So how's everybody doing?
If you want to just stop the live and we can chat later.
Yeah, we can. Yes, we can stop the live, and we do that how, Mila?
On the top left corner.
Top left corner. Not of the presentation. We need more.
Yeah, maybe stop